Hello everyone and welcome again to another Max Talk. Today is World Arthritis Day and joining us is Dr. Ramneek Mahajan, Senior Director, Orthopedics and Head, Joint Reconstruction Hip and Knee Unit here at Max Smart Hospital, Saket. Hello Doctor.
Hello.
Thank you so much Doctor for joining us today, and today is Arthritis Day, so we are going to need you to explain everything that we need to know about arthritis. So my first question is, what are the types of arthritis?
See, arthritis basically one has to understand is any inflammation around the joint. So arthritis means affection of your joint. Arthritis we have to take are four types, but I'll make it simple for the audience into early, moderate and late stages. In early stages can be then either grade 1 or grade 2, moderate is grade 3 and advanced or late stages is grade 4, when usually patients normally come to us in either 3 or 4 stage. 1 and 2 they normally manage on their own and very rarely in our OPD we see them.
थैंक यू डॉक्टर आर्थराइटिस पे एक बात आती है कि ये आजकल बहुत ज़्यादा कॉमन हो गया है, तो असल में आर्थराइटिस कितना कॉमन हो गया है आज के ज़माने में?
देखिए, आर्थराइटिस पर से हमेशा से शुरू से व्हेनेवर सिंस मैनकाइंड हैज़ बीन देयर आर्थराइटिस जोड़ों की दर्दें रही हैं. द थिंग इज हम लोग आजकल डॉक्टर्स के पास थोड़ा टाइमली जाना शुरू हो गए हैं, तो यस हम लोग जल्दी पिकअप करने लगे हैं कि ये जॉइंट की प्रॉब्लम है, ये बोन की प्रॉब्लम है. तो बेसिकली हम डिफ्रेंशिएट करने लगे हैं बिटवीन ऑस्टियोपोरोसिस एंड ऑस्टियोआर्थराइटिस. ऑस्टियोपोरोसिस मीन्स जब आपकी बोन वीक हुई और आर्थराइटिस मीन्स जब जॉइंट खराब हुआ. सो वी हैव बीन एबल टू डिफ्रेंशिएट एंड पिक इट अर्ली. पहले हम सब चीज़ों को ऑस्टियोपोरोसिस हड्डियों की कमजोरी बोल के निग्लेक्ट कर देते थे. आर्थराइटिस इज़ वेरी कॉमन and in India I think it is more common in females to the ratio of 2.7 per 1000 as compared to 1.3 in a male population.
So डॉक्टर हर बीमारी में रिस्क फैक्टर्स तो होते ही है, which brings me to the risk factors of arthritis.
See, आर्थराइटिस पर से आई थिंक जब आप रिस्क फैक्टर्स की बात कर रहे हैं तो आप मेरे से डीजेनरेटिव एज रिलेटेड उम्र के साथ जो आर्थराइटिस है, जिसको हम लोग आम भाषा में ऑस्टियो आर्थराइटिस बोलते हैं, उसके लिए बोल रहे हैं. बिकॉज आर्थराइटिस के अलग अलग प्रकार में रूमेटॉइड आर्थराइटिस, गाउटी आर्थराइटिस यानी कि रूमेटॉइड की वजह से जो जॉइंट खराब हुआ, गाउट की वजह से जो जॉइंट खराब हुआ, वो भी आर्थराइटिस है. बट रिस्क फैक्टर्स ऑस्टियो आर्थराइटिस में डीजेनरेटिव में है जब लेट्स से एक एल्डरली पॉपुलेशन, योर heavy, obese, something related to hereditary, that your parents had it, the younger generation gets it early, your lifestyle, sedentary lifestyle. In India, we can talk हमारा ज़मीन पे बैठना, the squatting, sitting cross-legged habits, using those Indian toilets in a squatting position, they all contribute to knee osteoarthritis.
डॉक्टर कोई भी डिजीज़ हो तो डिजीज़ का हमें पता कैसे चलता है? इज द मेन थिंग. देयर आर ब्लड टेस्ट, देयर आर इमेजिंग. सो आर्थराइटिस के लिए इज इमेजिंग एग्जाम द बेस्ट वे टू डिटेक्ट आर्थराइटिस?
See, arthritis per se, imaging is important just to tell us about what stage you are in your arthritis. Stage 1, stage 2, stage 3, stage 4. But along with that, we have to do some blood test and laboratory parameters to classify your arthritis. Whether a degenerative osteo will not have features of inflammatory arthritis. A gout will have uric acid raised. So if we have to manage arthritis, we have to first find the type of arthritis. And if primarily here we are dealing with age related osteoarthritis, so imaging is important. Along with that, the symptoms that the patients come with. So if you are very comfortable in sitting or lying down, but the moment you get up, you walk a few steps and you get pain, the startup pain, the crepitus, the friction crackling sounds in the knee, they all are also signs and symptoms related to osteoarthritis.
सो डॉक्टर इमेजिंग एग्जाम्स की तो बात कर ली, बट क्या ब्लड टेस्ट से आर्थराइटिस डिटेक्ट हो सकता है?
As I just mentioned, blood tests are important to find other causes of arthritis like rheumatoid, inflammatory, gouty arthritis. So all those other types of arthritis that help us to come to a diagnosis of that particular type of arthritis.
डॉक्टर, अब हम बात करते हैं प्रिवेंशन की, क्योंकि जब भी कोई भी डिजीज़ की बात होती है लोग प्रेफर करते हैं कि हमें हो ही ना. सो कैन आर्थराइटिस बी प्रिवेंटेड?
See, the prevention for an arthritis probably starts right from when you're trying to grow up. So youngsters have to remain fit, healthy, to get strong bones, flexibility around the joints by doing exercises and yoga, maintaining a healthy, balanced diet, an active lifestyle, and staying away from obesity. So it's like the amount of load that you put on that joint will lead to arthritis. So basically, a balanced, active, healthy lifestyle which might help you in preventing arthritis.
डॉक्टर, अब आते हैं लिविंग विद आर्थराइटिस के बारे में, क्योंकि अगर आर्थराइटिस हमें किसी को भी होता है, इट बिकम्स पार्ट ऑफ योर लाइफ फॉर until it's treated. So what is the outlook for someone who is living with arthritis?
See, people who are living with arthritis, they need to understand that they need strong muscles to take care of those joints. So they are expending more energy to do the same amount of work which I or you do. So let's say somebody has a bad case of knee arthritis, is not ready to do a surgery for whatever reasons. The moment they stand and walk a few steps, they are spending and burning more energy, more calories. The joint per se is loading more and the body is expending more energy. So they have to keep doing exercises. Exercises will help in muscle mobility and exercises will provide the flexibility to the joint. So basically they are keeping those joints supple, active, avoiding stiffness in the joints by doing exercises. So that is probably what you are aiming for. Trying to adjust in early stages with maybe using some heel wedges, maybe changing their footwear. In maybe grade 1, grade 2 changes, they can offload the painful joint by using some kind of modality like a stick. So that is how you can say that you can probably adjust your lifestyle around the arthritis. So maybe when you want to avoid stairs, you can use a lift going up. You don't have a lift and you want to use the stairs, so it's like use your good knee first. So going up, you use your good knee. So when it is like going up, you use the good knee, coming down, you use the bad knee. So it's like अच्छे कर्म ऊपर, बुरे कर्म नीचे. Just to remember, good knee first when going up.
Doctor, abhi you said how to do it. So my question is actually an extension to what you just said. And how can I make living with arthritis easier?
To make your life, if you're adjusting to your lifestyle, so the only thing that is simple activities where you avoid loading that knee. As I just said, try to avoid stairs, try to avoid squatting and kneeling. Probably sitting cross-legged is a bad idea. If you want to walk, walking is a good idea, but you can use a stick to offload the joint. Avoid going on a treadmill. Then looking at the circumstances that you are in, if you want to wear some shoes, you can use a long shoe horn instead of bending down to wear it. So when you want to have a bath, you can have a standing bath instead of sitting. If you have access, you know how to swim, then swimming is a good exercise. It burns your calories, keeps the joint mobile, but does not load the joint. So these are one of the few measures that you can do to live with arthritis.
So डॉक्टर, एक बहुत ही अफवाह होती है कि अगर बारिश हो रही है, मेरे को लग रहा है क्योंकि मेरे घुटनों में दर्द हो रहा है, ये हमने बहुत टाइम से सुना हुआ है. So do certain types of weather actually make arthritis worse?
See, it is said that when there are changes in the atmospheric pressure outside, your joints also react. So that is why if you see, whenever it's a heavy weather, gloomy, rainy season, your joints actually tend to swell up. And that is basically your knee is trying to adjust to the atmospheric pressure. People do experience those changes, but these changes are actually more seen with people with inflammatory, a rheumatoid or a gouty arthritis than a pure osteoarthritis. But yes, if there is a lot of vasoconstriction, you expend and spend less energy during the winter season. So that also causes pressures and increase in pain during winters.
थैंक यू सो मच डॉक्टर। डॉक्टर वो अर्थराइटिस डे पे हमारे ऑडियंस जो अभी देख रहे हैं उनके लिए आपकी तरफ से कोई खास मैसेज?
Life is mobility. Mobility is life. So that means चलते रहना है. We cannot afford to sit. We cannot afford to stand on a platform. This train of life is moving. You have to find the right time to board it. You cannot be left behind. So if you have something which is treatable, even if it is surgery, you should not shy away from it, because these are lifestyle, these are the arthritis, they are affecting your quality of life. And not all surgeries are replacement surgeries. Remember, there are ways to prevent a major replacement surgery by doing some other smaller surgical procedures as well. You have to be at the right candidate for that. So find your doctor, find the best way to treat your arthritis and keep living. Do not think of living with arthritis. Think of life is mobility and mobility is life.
थैंक यू सो मच डॉक्टर। जाने से पहले मैं अपने दर्शकों को बताना चाहती हूँ, इन केस यू हैव एनी क्वेश्चन यू कैन राइट देम इन द कमेंट सेक्शन बिलो एंड वी विल गेट बैक टू यू। इफ यू वांट टू हैव अ वन-on-one consultation with our doctor, you can dial the number on the screen and book your appointments, or you can click on the bit.ly link that is in the description box below. Max Hospitals are safe and green, and we are always here to answer all your queries and help you out. Once again, thank you so much for joining us today, doctor, and I'll see you in the next one.
Thank you.